Hello, and welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving health and well-being in the city of Chicago. Community Pulse is presented by the Foxglove Alliance, a public health coalition supported by the Hectone Institute of Medicine in partnership with the Healthcare Council of Chicago, HC3, which is managed by Third Horizon Strategies, as well as the Hectone Nurses in the Humanities. My name is Meghan Philipp, and I am your host for today's Community Pulse. I am the Executive Director of HC3, the Healthcare Council of Chicago. On one of our most recent episodes of Community Pulse, it was hosted by one of my esteemed colleagues, Levi Moore, who interviewed Melissa McGuire from IAFCC, the Illinois Association of Free and Charitable Clinics, to gear us up for August, which is Illinois Association of Free and Charitable Clinics Month. So it is without further ado that I introduce today's guest, the CEO of one of Illinois' largest free and charitable clinic, Community Health. This is Steph Wilding, the CEO of Community Health.
Hey, Meghan, thanks for having me.
I'm glad to have you here. I am super excited to talk about, for our viewers that don't know what Community Health is, where you are located, please tell us a little bit more about Community Health's mission and what you do here in Chicago.
Absolutely. Well, first of all, happy Free and Charitable Clinics Month. Yes. In August. So Community Health is actually the nation's largest volunteer-based free health center. For 30 years, we have been providing free health care to primarily uninsured, but also some underinsured individuals. We provide primary care, specialty care services, dental care, behavioral health. We have a full pharmacy, and we also do health education and community outreach. And we have 3 locations throughout the city of Chicago, including Little Village, Belmont-Cragen, and Humboldt Park. But we actually serve patients from every single zip code in the city, which I think is pretty fantastic.
Yeah, absolutely. So how long has Community Health been operating here in Chicago?
Well, I'm really proud to say that we are celebrating our 30th anniversary this year.
Congratulations.
Thank you. And so Community Health was founded by Dr. Serafino Gorella, who went door to door over 30 years ago and was really surprised to learn that more than half of the individuals that he spoke to didn't have access to healthcare. And so Serafino, as we call him, did what he did best and did something about it and took action and didn't take no for an answer and leveraged his personal and professional networks and resources in order to start Community Health. And we're proud to say that 30 years later, we are still going strong.
That's amazing. So how does an establishment like this continue to provide those services? What does that look like on a day-to-day basis, and who provides services to Community Health?
Yeah, so Community Health is a really interesting business model from a community health center perspective. I think individuals are often familiar with what are called federally qualified health centers. So what I always say is that Community Health is just like a federally qualified health center. It's just how we pay for it is a little bit different, but the care we provide is exactly the same. Mm-hmm. And so Community Health has a 3-pillared business model, the first of which is volunteerism. So we have over 1,000 volunteers that make our mission possible, including the majority of our medical providers, our lab workers, our triage workers, our interpreters. We are relying on the generosity of tens of thousands of hours of service in order to provide care to our patients. Our second pillar in our business model is philanthropy. Just like any nonprofit, we're raising our dollars. And then our third pillar of our business model is partnership. We partner with academic medical centers, large corporations, individuals that give in-kind goods and services to make our mission possible and to be able to provide the highest quality of care to our patients. And so it's definitely a different way of paying for healthcare, but because of our business model, that means that for every, for example, $1 that you donate to Community Health, we provide $7 worth of care, which means we don't have to pass on any cost to our patients. So for so many of our patients, when they come to Community Health and they end their visit, they say, how much do I owe? And when we reaffirm to them that this is free care, that we'll be providing all of their care today and always at no charge to them, for most of them, it's the first time in their lives that they've experienced the complete removal of financial barriers to care. And we wouldn't be able to do that without a really innovative business model.
That's fantastic. Tell me a little bit more about some of the partnerships you have, especially with your volunteers.
Yeah, absolutely. So one of our secondary missions at Community Health is really to serve as a training ground for future providers. So we work with most of the medical schools in the city, as well as a number of the residency programs, to host both medical students and residents who are, growing their clinical training. And now they have a chance to do that in a community health center setting where, how we provide care is a little bit different because we aren't relying on billing for payment. And so that, I think, is one of the partnership areas that we're most proud of. And in fact, I encourage anyone who is adjacent to anyone who works in healthcare to mention community health. One of my favorite party tricks is to be someplace and mention that I work at Community Health and have someone say, oh, I was a student there. I trained there. We are really such an incredible sort of entry point to what community healthcare looks like for thousands of providers, not only in Chicago, but throughout the country, who go from medical school to a residency program in another part of the country. So that, I would say, is one of the partnership areas that we are really, really proud of and that we see as being a secondary mission of ours.
Absolutely. So tell me more about what access looks like and some of the barriers that patients have faced. You mentioned the multiple locations, but I know historically it's just been the Westtown area that you service, but to your point, it has multiple zip codes. So tell me about some of that expansion and how you continue to meet your patients where they are.
Yes. So I have been with Community Health just under 4 years now. And when I started with the organization, we had one location in Humboldt Park. And so it's what we today call our headquarters location. And very shortly after I started, actually about 100 days, a global pandemic was declared. And just like everyone else, overnight, Community Health pivoted to an entirely new model of care, focusing heavily on telehealth. And in a short amount of time, we really began to see the benefits of telemedicine for our communities. Specifically, we noticed that the no-show rate for our patients, which is the rate at which a patient doesn't come to an appointment and also doesn't call to cancel that appointment, it plummeted overnight. And rather than just sort of skating by that statistic, that fact that we saw, we really asked ourselves, what's going on here? And it was such an aha moment. Safety Net Healthcare, in Safety Net Healthcare, we all spend an exorbitant amount of time really trying to be thoughtful about how do we reduce barriers to care, whether that's transportation, childcare, et cetera. But I think what's really interesting, and a lesson that we only learned at Community Health through the pandemic, was this idea of what if we just removed all barriers by meeting our patients where they were, rather than requiring them to come to us? And so out of those first few months of the pandemic really grew a vision for Community Health as we continue to proceed in the pandemic and also beyond, now that the public health emergency is over, which is to challenge ourselves to rethink space and place for point of care so that we're always prioritizing meeting our patients where they're at. And so that is the concept that really gave birth to this idea of opening microclinics in the neighborhoods where we know our patients live and where they work. And so that really started in April of 2021. We opened our first micro clinic inside of a community-based organization in Belmont-Cragen called Onward Neighborhood House. And when we say micro, we mean micro. It's less than 1,000 square feet. But what it does is it places a door in the community where they can access their critical primary care and soon-to-be specialty care services. And for us, Belmont-Cragen was targeted because almost a third of our patients, our existing patient base, lived in that area. And what we found in the first few months of opening that first clinic was story after story after story of a patient who was traveling 80 minutes one way on public transportation to come to our location in Humboldt Park, sometimes 4 times a year or more, they were now only walking a few blocks to go and have that same medical appointment, a lab visit, a primary care visit to pick up their medication. And when you think about that, an 80-minute commute, that's a half day off of work. That's finding childcare. That's honestly being more food insecure that week because you took a half a day off of work. And we eliminated all those barriers simply by opening a micro location right in the neighborhood. And also because we opened up inside of a community-based organization that was already addressing our patients' social determinants of health needs, such as childcare, immigration assistance, legal assistance, food access. We also now have a red carpet integration with that community-based organization. So if we have a patient who is food insecure, we don't hand them an informal referral. We can now just say, hey, go talk to this individual up the hall. They're going to get you set up with food today and get you enrolled in the program. And so really expanded the way, not only from a location perspective, but expanded how we thought about our work so that we are really visioning what it is to meet our patients where they are at. And this first location was so successful that a little over a year later, we opened our second location inside of Enlace in the Little Village neighborhood. And both of these locations have continued to expand hours. I can tell you right now, both of them are well over capacity and looking for further expansion. And we know that we're meeting our patients where they're at.
That's great. And I want to think about, you mentioned these partnerships and the co-location and access. And I know that also community health has been mobilizing. We have an influx. I read in the Tribune last week, there were 12,000 migrants that have arrived in Chicago since last year, many of them arriving even since January. So with that uptick in people that are literally just coming to Chicago and needing health care, how has community health stepped up to help the city and help these folks that are coming into Chicago?
Yeah, I think it's really important to note that the vast majority of people that are asylum seekers that have arrived in Chicago have been sent here. And by border states, and has required a monumental collaboration and collective effort by the city of Chicago and dozens and dozens and dozens of organizations, including community health. So currently, the situation as of August 1st, it's always important to note the date because things are changing really, really quickly, is there's a little over 800 individuals who are currently living inside of police precincts throughout the city of Chicago. And then there's about just under 5,000 individuals who are living in temporary shelter. So in order to meet the hierarchy of needs from shelter, food, clothing, healthcare, et cetera, organizations from across the city are stepping up, including community health. So at the end of April, beginning of May, the city of Chicago asked us if we could step up to provide health care to asylum seekers who are staying in the police precincts. At the time, community health had never done mobile medicine before, mobile care before, but in less than 10 days, we mobilized, and within 10 days of being asked to provide this care, we were on site at a police precinct providing street medicine to asylum seekers who are living at that police precinct. We started out doing so in partnership not only with the City of Chicago and the Office of Emergency Management, but also in partnership with Lori Children's, who went out with us to provide care for the kiddos, and we provided care to the adults. And during those visits, we're able to do triage, some basic healthcare assessment. We're also able to do a number of point of care tests, including point of care COVID, flu, strep, urinary tract infections, pregnancy, et cetera. And then we're also able to give out a lot of over-the-counter medication. And finally, if someone is in need of a prescription medication, we're able to leverage our partnerships with the mutual aid societies that exist at each of the precincts in order to pay for the small or nominal costs that may exist for those medications. And so in the last few months, Community Health has provided access to mobile care to hundreds of asylum seekers at the precincts. And we've had a pretty significant number of them come to one of our 3 locations as well for follow-up care. And we're actually seeing a massive influx of referrals from other organizations to our 3 health centers as well, because the healthcare needs are significant. Well, I should say the needs in general are significant. and healthcare being a big one, including for mental health care. And then I would say the other area that we see a lot of is just injuries that occurred from the journey to arrive at the border and then to come here to Chicago. And so this is an example, I think, of what makes free and charitable clinics really unique. We were able to begin providing a service we had never done before in 10 days. And it's through that business model that I mentioned earlier that made that possible. We were able to tap into our volunteer base to say, we are going to be providing this service. We need interpreters, we need triage workers, we need providers. But we also need even more providers at our other locations because we're going to be seeing more patients. We were able to put out a call for donations to our philanthropic partners and individual donors. And we were able to leverage our partnerships with the City of Chicago and Lurie's Children's in order to make this a more comprehensive, collaborative, collective approach. And so I know when people talk about business models, sometimes I'm gonna be like, okay, Snorefest. But I think it's really important to highlight because that business model allows us to innovate. It allows us to be nimble. It allows us to respond to communities with what they need when they need it and to do so quickly and comprehensively.
Yeah, I mean, I think that's an incredible testament to the innovation, the flexibility that you continue to provide. I think it's truly impactful and necessary for Chicago. So, you know, you touched upon it already, but I just want to highlight some of the referral network that you have. You know, the way that we think about access to healthcare is, of course, some of the primary services that are being provided by your providers and volunteers and support. But, you know, when you cannot, you know, offer beyond medicine, what are those partnerships for food and housing and other things that are plaguing some patients? And how do you navigate some of those things?
Yeah, so I think, you know, because community health has this pillar of partnerships it's in our business model, but it's also in our model of care. I think this is an area that we're really lucky to have so many incredible partners. You know, we see social determinants of health as absolutely vital to improving someone's overall health and wellness. And I think one of our biggest lessons during the pandemic, in addition to rethinking space and place, has been around food as medicine. Yeah. And I think that's where those co-locations of our clinics are really, really important because the experience of the communities we serve, they have so many barriers to accessing everything. Even some geography. There's just not things located in these communities that have, you know, historical and sometimes purposeful disinvestment in them. And so those partnerships become really key. And I think our really shining partnerships with Onward House and Enlace are great examples of how we really are making sure to address patients' social determinants of health in their visits. So for example, at Enlace, their navigators are actually integrated into our clinic sessions, and they're doing social determinants of health screening. Healthcare, we have so many acronyms. Social determinants of health screening, and linking those patients with services that are needed right there and right then. So they actually act as like a supplement to our clinical care in that moment. And we are also ourselves deploying social determinants of health screeners and are using platforms like Unite Us to be able to link patients to those needed services. But really, I think as we look forward, the lessons that we've learned during the pandemic, the lessons that we've learned during this new crisis, the migrant crisis, there's a lot of consistency here. And one of them is that the collective effort piece requires a major de-siloing of effort. And I think our microsite locations are a great example, and we're seeing other places where this is happening at larger scales too, a great example of, I like to say, not just like collective partnership, but like we're roommates. And so,
nice.
We're roommates. And so it's not just collaboration, it's co-location as a form of collaboration. So that we are collectively removing those barriers for the individuals so that we're building efficiencies into the process and hopefully being a little bit more effective, in addition to being efficient, being more effective at those partnerships as well.
All right, so before we close out, tell me and our audience here today where any potential patients should go and where anybody that wants to support community health can go to learn more.
Well, to learn more, including to know where our locations are, what services we provide, how you can help or donate, communityhealth.org is our website. We also are the host of an event series that is currently active, which is another great way to get involved, which is All in Chicago, which is a thought leaders series where we are bringing together key stakeholders to discuss how we can bring healthcare to all Chicagoans so they have the right healthcare in the right time and the right place. But as a good starting point, communityhealth.org and anywhere on our social media.
That's awesome. So you will go to communityhealth.org to redirect any of your questions and your ways of donating or finding out more if you want to be a patient. Thanks for your time today. It was tremendous to have community health here and to support Illinois Free and Charitable Clinics Month. Today's program will be aired on Channel 21 CAN TV, or you can stream it on CAN TV's app or online. This is Community Pulse. My name is Meghan Philipp. Thank you for being here.